Hysterectomy. What is it? Why would you need it? And if you have planned a hysterectomy, what should you know about it? Hi, I'm Dr. Astha Dayal and I'm the Director of Obstetrics and Gynaecology with CK Birla Hospital in Gurgaon. So let's talk about hysterectomy, or the surgery for removal of the uterus. Now earlier on we used to do hysterectomy for any reason, for any bleeding problem, discharge, pain. But nowadays we don't want to do hysterectomies because there's so many medical and non-surgical options available. So when would you need a hysterectomy? If your medical or non-surgical options are not working for you and you're having a lot of period pain, period bleeding, fibroids, endometriosis, or sometimes if we suspect a cancer. Sometimes with age, when your uterus moves down, which is called a prolapse, then also we may need the removal of the uterus. So nowadays we are very reluctant in doing a hysterectomy unless it is really needed. The second thing, nowadays we don't do hysterectomy by open procedures as long as we can avoid it, because open surgeries takes a long time for recovery and it takes about 6 weeks to recover from a big surgery which is done in an open way. Now only in certain cases like certain ovarian cancers will you need an open surgery to remove the uterus. In most cases we manage with a laparoscopic route or a vaginal route or a robotic surgery. So all these are minimally invasive procedures and you recover in 1 to 2 weeks and you have a better quality of life. Another thing which has changed over time is now we do not like to remove your ovaries until and unless there is a suspicion of a malignancy or a cyst in the ovary. So we only remove the uterus, we remove your tubes, because studies have shown that the tubes could be causing the origin of ovarian cancer, and the tubes are only needed for pregnancy. So we remove the tubes, we remove the uterus, and we remove the cervix. But we like to leave the ovaries inside so that your hormones keep working and your menopause does not come suddenly. Now if you have to undergo a hysterectomy, you must discuss with your doctor what is the route of hysterectomy, what all organs will they be removing, what complications are we expecting in hysterectomy. Now when we go for a hysterectomy, like any other surgery, there are certain complications that can happen like bleeding, infection, injury to surrounding structures. If you have a long surgery or if you have certain risk factors like obesity, smoking, immobilization, diabetes, hypertension, etc., then you could also be at a higher risk of deep vein thrombosis or blood clotting disorders. So whenever you go for a surgery, you make sure that you are in your best of health, you have controlled all your medical issues and then gone in for a surgery, and after the surgery try and ambulate yourself faster.